Hey, hello. How are you?
All right, yourself?
I'm good, thanks. My name is Heather Lebenz. I'll be your student physical therapist assistant today. Could you confirm for me your first and last name?
Damien Flores.
Okay, nice to meet you, Mr. Flores. So I've got your chart here and your plan of care from the physical therapist. Looks like we've got you in for some neck pain, some tightness, dealing with some headache stuff, especially with work and maybe some postural related things. Could you tell me a little bit more about the pain, where it's at, how it feels? Is it like sharp, dull, achy?
It's sharp.
More sharp?
A little more on the right when I turn, something hurts.
More on the right side. Okay. When you turn, you said, is when you feel it more? Okay. On a scale from 0 to 10, 10 being like emergency room level pain, where would you say you're at on that scale just right now at rest?
Like a 3.
Like a 3?
Yeah.
And then when you are turning or after a long day at work, how high does it get up to?
Probably 7.
7, okay. So headaches, has there been any change with those, or can you describe a little bit where you feel those when you get them?
Kind of more like in the front, you know,
Okay.
those kind of headaches. They rarely turn into a migraine, but yeah, just a lot of frequent headaches lately.
Okay. Yeah, so today what I've got from your physical therapist, we'd like to start off with some moist heat. So I've got a moist heat pack that would just wrap around your neck, and also get in and do some soft tissue mobilization, which would just be like working in that area with my hands, doing some palpation, but then some release techniques to help with tension. Ultimately, we want to just decrease that muscle tension for you, increase circulation to the area, and hopefully help decrease pain overall. And so essentially that would take 20 minutes today. We'll start with that. Anything that you would be concerned with doing that, or do I have your consent to do that today?
No concerns, and yes, you have my consent.
Okay, perfect. Just definitely let me know at any time if you feel any discomfort, any change of symptoms, or increased pain or anything, okay?
Okay.
I just have a pretty extensive list here of different contraindications or precautions, which would be things we want to be aware of before we get started with any of these. So I'll just run through these. Just let me know if you have any of the following, okay?
Okay.
Any recent hemorrhage or possibility of hemorrhaging?
No.
Any thrombosis?
No.
Any impaired sensation in the area that you're aware of?
No.
Any malignant tumors?
No.
Any acute injury or inflammation in that area?
No.
Are you pregnant?
No.
Any impaired circulation
No.
or poor thermal regulation?
No.
Do you have edema or swelling in that area? Cardiac insufficiency?
No.
Any stable metal in the area?
No.
Open wounds?
No.
Any topical counter irritants like analgesics or spray?
No.
Any demyelinated nerves?
No.
Arteriosclerosis?
No.
Any abscesses?
No.
Severe varicose veins?
Nope.
Synovitis?
No.
Cellulitis or skin infections?
Nope.
Okay, and just based off our conversation, I can tell mentation's intact, so that's good. Do you have any jewelry, necklaces in the area?
No.
Okay, perfect. All right, so I think we're all set then to get started. First thing, I just want to take a look at the skin. I'll do a couple sensation tests just to make sure everything's good in terms of using the moist heat pack.
Okay.
So I've got hot cold test, and I'll just do like a light touch test, but I'll let you know, or we'll go over that as I get you set up. I'm just gonna drape the area with some towels so we don't get any of the moist heat, like water or anything on your shirt. Is that okay with you?
Yeah.
Okay, perfect. So we'll go ahead and get started with that first. I'll have you just stay seated in that area, but I've got some pillows. Do you want me to sit or place this behind your back?
Yes, please.
Okay. Go ahead. So let's go for a little bit. Okay. Is that okay?
Mm-hmm.
And then this, you can just rest your arms right here. Okay. So I'm just gonna use this towel to drape. So I have access to the neck. Is that okay? Not pulling. Okay. So just kind of checking out skin, making sure everything's intact, no abnormal redness, warmth, open wounds, rash, anything like that. Looks good. And then if I was just to palpate around, just let me know in this area when you feel any of that tenderness, pain, yeah? Up and through the neck. Is it pretty much both sides?
It's a little bit of both sides, more the right, but
More on the right when you turn, so on this side? Okay. Okay, good. So we'll know where to target with that soft tissue mobilization. Let me grab the stuff for these sensation tests. First one I've got here is just light touch. So I'll just show you on your arm right here. It's gonna be a little swipe with the cotton ball right there. I'm gonna just go in various areas around the neck and the upper back there. I'll have you close your eyes, and whenever you feel the touch, I just want you to say yes. Okay? So we'll do a few areas. So go ahead and close your eyes. Ready?
Okay. Touch, 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 touch.
Okay, perfect. So light touch sensation is intact. I've got these hot and cold rods just to check for thermal sensation. Okay, so one rod for that's warm, hot. Feel that? One that's cold.
Okay.
Feel that? Okay. So I'm just gonna go again in various areas around this neck area. Just close your eyes and then say hot when you feel hot and cold when you feel cold, okay?
Okay. Hot, cold, cold, hot, 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 cold, hot, cold.
Okay, perfect. So sensation is intact there. Alright, still feeling okay?
Yes.
Okay, perfect. So now get the hot pack all set. Make sure the hydroculator temp is good. So we're at 160, which is where we want it. Again, we want this to be comfortable, strong warmth, not burning, tingling, anything like that. So definitely let me know if it starts to get too hot.
Okay.
We've got quite a lot of towels here between you and this hot pack, so it should be that comfortable warmth. This is a call bell for you, so feel free to push that if you need to. If it starts to get too hot, someone can come take this off for you.
Okay.
And I'll also come back and check in 5 minutes. Alright, so I'm just gonna put this right on here. I want it to be pretty snug. Is that okay?
Yes.
Okay. Is that okay?
Mhm.
Okay. So we'll get started with the timer. Again, bell's right here. Just relax for about 5 minutes. We'll come give a skin check. And then we'll do another 5 minutes.
All right. Thank you.
Okay. All right, so it's been about 5 minutes. Let me take a little look at the skin. How's it feeling?
Pretty good.
Good. Not abnormally red or anything, some slight pink color, a little warm, so that's good. We'll let you keep going for another 5 minutes. Okay, you okay?
Yep.
Okay, good. It didn't get too warm for you?
No.
Perfect, yeah, we've got about 6 layers in between you and this hot pack, so it should be nice and comfortable. Let's take a look at the skin. I'll wipe off any wet water. Okay, looks good. Where would you say you're at now on that scale from 0 to 10?
Probably a 2.
2?
Yep.
Awesome. Good, so we'll let the PT know that that responded well. So now what I'm gonna have you do is actually transition onto the table to do a soft tissue. Alright, so now we've got you set up, draped. You feel okay?
Yep.
Okay, so we're gonna start with that soft tissue mobilization. Again, I'm just gonna be working along the neck here, upper traps in this area a little bit. Just let me know if at any time you feel any discomfort at all, okay? Just want it to be, first we'll just start for about a minute to warm up the area, then I'll get in, do a little bit of trigger point in this upper trap area if we find any of those tension spots or not. And that'll just be like a little bit of a squeeze and release. So we wanna just help the tension release in that way. Just remembering to stay relaxed as much as possible, take some deep breaths, and then we'll finish with a little bit of a suboccipital release under the neck there, okay? So it'll just be like holding under the base of the head. So just let me know, okay, if at any time you want me to adjust anything.
Okay.
We've got this cocoa butter here. Kind of warm up the area, help to push that circulation, improve venous return back down into the heart, okay? Do this for about a minute. Does that feel okay?
Yep.
Okay. Okay, so we've kind of warmed up in the area. How are you feeling?
It's good.
So we got started off a little lighter pressure there. Just gonna get in, just kind of wipe off the lotion now in this spot to do a little bit more trigger point, okay? I don't want it to slide too much. Okay. Just right in here, feel a little bit of tension. So I'm just gonna hold. Just deep breath. On this side, just hold. Breath, any pain with that?
No.
Okay. Do a couple more spots. How about there? Is that okay?
It's good.
Okay. Alright. To help with headaches, I just want to get back here to work at the base of the skull and some of that suboccipital muscles I was telling you about. So I'm just gonna use my fingers here and apply some pressure. Just let me know if it feels uncomfortable at any time, okay? Okay. Okay. Just kind of hang out here for a bit.
Good, that's good.
Good. And just kind of finish with a bit of that effleurage again. Finishes our soft tissue mobilization treatment. Are any of this, got a baby wipe here just to wipe off some of that lotion, so. Alright, I'll go ahead and have you sit up. And just wipe off the rest of this area. Alright, so how are you feeling on the pain scale again?
1.
Go 1?
I can barely feel
Okay.
pain, but yeah, it's
Good.
almost
Skin
not
looks okay. A little bit of redness just in some of that trigger point, but feeling okay. So I'll let the PT know that everything responded really well. So maybe
that
we
pain
can
scale.
continue on
Great.
with that. Couple things for at home, just to be aware of as you are someone who sits at the computer often. When you said that, just making sure you've got that upright posture, potentially like a pillow behind your back, keeping that chin up and back, the monitor at eye level will be good. If you have a heat pack or access to one, you can get one of those that are the moist heat you can put in the microwave, or if you have like the electric heating pad, you could use that. Just make sure there's a timer on that so it doesn't stay on or cause burning. Just keep it on for like 15 minutes or so every 2 hours with the heat, okay? Any questions for me?
No.
Okay, then I think you're all set. So I hope you have a good day.